ዛሬ የጋበዝናቸው እንግዶች አሉ እና ውይይታችን በእንግሊዘኛ ነው የሚሆነው እና እነኚህ አይ ቲንክ በአማርኛ እጽ ነው የሚባለው አንዳንድ ናርኮቲክስ ወይንም እጾች በኮሚኒቲያችን ላይ በተለይ በወጣቱ ላይ ያለውን ተግዳሮት እንዴት መቋቋም እንደምንችል በኮሚኒቲያችን የሚያስረዱ እንግዶች ከሃርበርቪው ኦፖይድ ፕሮግራም ከሚባል ቲም እንግዶች ጋብዘናል እና እነሱ ስለ ጉዳዩ በእንግሊዘኛ ካስረዱን በኋላ መጨረሻ ላይ ጥያቄና መልስ ውይይት ይኖረናል ማለት ነውና ሁላችንም ሚውት እናርግ ስልካችንን እነሱ ሲያስረዱን ማለት ነው እና አሁን በእንግሊዘኛ ዞርና ወደ እነሱ እንገባለን Okay. Hi everyone. This is Tagga from the Ethiopian community in Seattle, program director here. We have Salim, our program assistant, and I think we also have Sophia online, our executive director. Thank you to Adi and Elsa from the Opioid program for joining us for today's workshop / discussion. We'll start with them introducing themselves, and then you guys we can help with sharing your PowerPoint, and then after the presentation, we can start the Q&A at the end. I've already introduced the program in Amharic to our participants, and we can go from there. So over to you guys, Adi and Elsa.
Salam, that's not true. Elsa name. My name is Elsa. I work at Harborview Medical Center. I am the program manager for our office-based opioid treatment program. And I'll tell you more after intros about how long we've been around.
Hello, I'm Addie Adwell. I'm the nurse care manager and assistant nurse manager of Harborview Medical Center's office-based opioid treatment. And should I start, Elsa? Or
yeah, why don't you start with the overlining things about opioids in the community, and then we'll get into the specifics around the programming.
Okay, great.
Elsa, I think. Oh, I was going to say Elsa's, or is it me? Can you hear me well? Maybe Elsa's voice was in and out.
Can you hear me now?
You were able to hear, yes.
Okay.
Okay, maybe it's my internet. Okay, thanks.
Okay, let me share my screen here. I have a few slides, not too many. And I'm going to start from the beginning. Are people seeing just a slide? No notes attached to it? Okay, thanks, Elsa. All right, so we're going to talk about the office-based opioid treatment program at Harborview Medical Center, and this is sort of our outline for our time. We want to discuss kind of from a 30,000-foot view, big picture trends in youth substance use, and then understand the risks specifically associated with opioid use for youth, understand the resources for overdose reversal, and then describe the Harborview program and leave lots of time for discussion and Q&A. So what do we know just sort of globally in this country about youth substance use trends? It is good news. I'm here to tell you. There's a study that's done every 2 years called Monitoring the Future, and it's done with 8th graders, 10th graders, and 12th graders. And over the past decade, those numbers of people who have been reporting illicit substance use in those age groups have been trending down. So we know that across the board, substance use among youth is trending down. And we also know that really most youth are not using opioids. You can see in this particular slide, it's 5.4% of 8th graders, 11.7% of 10th graders, and 4.8% of 12th graders. So it's a small slice of the youth population who are reporting even any past year illicit drug use, not just opioids. So that's a bright spot for us to start out on. It's just that this is important, something to think about, and also it is trending down. Youth substance use prevention really kind of takes the whole community, and actually we're doing it right now by talking about substance use. So one of the key ways to prevent substance use or kind of downstream or effects of substance use is to talk about substance use with youth and to do it early and do it often. Other things that are helpful in prevention are providing safe and healthy activities for young people that are meaningful and that they enjoy. Providing supports for mental and emotional health, and I have some resources included today. And then educating youth about the resources that are available for them to help each other. Again, I have some resources for that today. Overdose reversal, if they have a friend or community member who is exposed to opioids, and then the Good Samaritan law so that they know that they aren't going to get in trouble if they call for help. So this is one of the resources that I wanted to share today specifically. This is Teen Link. It's a confidential and anonymous line for youth, for teens, to talk with trained teen volunteers about any issue they're concerned with. And this is part of that net of emotional and mental health support that's available to people in the community that's part of substance use prevention. And it's available daily via chat and text. I know a lot of my younger patients don't really love talking on the phone, so having those youth-friendly ways of communication is really important. And they also do have they do offer chat services in other languages, and they can get one-on-one interpretation on demand. Another resource for really anyone who needs help connecting with resources around substance use disorder in our community is Washington Recovery Helpline. And this isn't limited just to opioids. It's not even really limited just to substance use. They can also help people who are struggling with gambling disorder. But this is a really excellent resource. And again, it's part of that prevention pipeline, is getting people connected to care really early, kind of at the first notion of somebody needing help, not delaying care, because sometimes people don't know where to go. Hopefully now this group knows where they can go to seek help. So I just told you, hey, good news, lots of youth aren't even using opioids. And you may be thinking, well, why should we talk about opioids if most youth aren't using opioids? And it's really because the risks associated with opioid use are really high. And they're high because the risks involve overdose, which is taking too much of a substance and then depressing your breathing, which can lead to death, which is the worst outcome related to opioid use, and is impacting really every community in the local area at this point is being impacted by overdose and other associated harms from opioid use. And it can also develop into opioid use disorder, which is sometimes referred to as an addiction. But what opioid use disorder is continuing to use opioids despite the negative consequences of that use. And it also can really impact a person's relationships. It can impact a person's school and academic work. It can impact their work, and it can really change their thinking. So these are some of the associated risks of opioid use. And it's a reason we're spending so much time talking about it today, is because the risks are very high. One of the things making the risks so high right now is that right now in our communities in Seattle and King County, we have a lot of fentanyl in the community. Fentanyl is an extremely powerful, potent opioid, and young people may not know that they're using it. They may get a pill from a friend, and maybe they're told, hey, this might help you sleep. Hey, you have anxiety. This might help you feel calmer, not realizing that they're using the most potent opioid available, putting them at an extremely high risk of overdose. And why do young people use fentanyl? The reasons are many. It could be because, again, they're feeling emotional pain, they're feeling anxiety. A friend said, hey, here's a tablet that can help you out. They might be sensation seeking. They might be using to feel good or because it's available. There might be social pressure. They might be using it actually to help them sleep at night. Lots of youth or young people have sleep disruption and take a pill from a friend in order to sleep. They might have physical pain. There are really lots of reasons that people turn to using substances, and they're pretty understandable. And it's really important that we communicate with youth about what the risks are of these particular pills that we know are out in our community right now. And so there's actually a lot that we can do related to opioid use and opioid use with youth. And we're actually doing one of the most important things right now, which is we can educate each other about the risk. And we can especially help youth educate other youth about the risk, right? So these are some flyers that are available through King County Public Health and through on the app Snapchat, just specifically to get out among youth about the fake, they're fake oxycodone is what they are, but they're actually fentanyl, to educate about the risk and also to encourage youth to carry naloxone, which is the medicine that reverses overdose. And so that leads me to my second, what can we do, which is we can all carry naloxone. Everybody can carry naloxone. You do not have to be 18 years old to carry naloxone. It's an incredibly safe medicine that's used to reverse an opioid overdose. It doesn't have any effect on any other person who hasn't taken opioids. It does one thing only, and it's reverse opioid overdose. It is effective for fentanyl overdose, and it may take more than one dose to do it. I put a link down here to a video of a step-by-step video on how to use it. And I'll just show you. I'll put my money where my mouth is. This is my bag. Here's my naloxone. I carry it with me everywhere. I think this is really something that youth can be doing in the community. It's something that we can be doing in the community. And we know from studies of kits that were distributed through Washington State that the most likely person to use a naloxone kit in our community is a bystander. It's not a medical professional. It's not a law enforcement professional. It's a bystander. It's somebody like me who's there with my bag, with my naloxone, reversing that overdose. And the last thing that we can do is we can help people who we know have that opioid use disorder or who we're worried about, who we think might be struggling with opioids, access treatment. And the treatment for opioid use disorder or people who are using fentanyl and can't quit is medications for opioid use disorder. They're the frontline treatment for this disorder. And experts who work with youth recommend these medications as the frontline treatment. So these are some of the resources that I had in my presentation today. And when I send the slides, all of the links will be available. The video on how to use naloxone, the overdose reversal medicine, is on lacedandlethal.com. And that's also a website where you can go and enter your King County mailing address, and they will mail you free of charge a naloxone kit for you to carry with you yourself. And I'm gonna stop share and turn it over to Elsa.
Thanks, Addie. Can you guys hear me okay?
Yes.
Okay, great. I'm gonna share my screen. Can you guys see this? Great. So I'm Elsa. Addie and I work closely together on all things opioid treatment here at Harborview. I'll tell you a little bit about our program. We've been around since 2015. We're federally funded. We have many grants now over the years that are funded by the Drug and Alcohol Administration of the federal government, called SAMHSA. We have built a team of professionals around opioid treatment. Here's all the classifications: nurses, program managers or coordinators who are helping navigate patients between clinics, or helping navigate patients into our health system, and peer support specialists, those who have lived experience, those in recovery themselves, and can really attest to their experiences, and help share stories with individuals as they are contemplative or just in the part of their lives where they're ready for treatment. So meeting them where they're at. And physicians, we have a team of docs all over the system who are waivered, which means they just have a special kind of license attached to their medical, DEA license to be able to prescribe this medication that Addie mentioned, buprenorphine, Suboxone, so we can help patients feel better. Part of a lot of our programming happens in primary care clinics, although we are in many other clinics, such as the pediatric clinic, which is primary care. So we're serving a younger population. We're also in the Pioneer Square Clinic, which is kind of down the street. It serves a somewhat different population. We also have our mental health and addiction recovery programs. There's behavioral health and mental health programming there, more intensive outpatient programming for those who need more counseling, more therapy attached to their recovery process. And we also have partners in the community. Here's a link here. Addie did share this. This tool, the Washington State Recovery Helpline tool, also gives you, you could put in your zip code and it kind of just gives you a list of different providers close to you that would be able to offer resources and support. Our base model is to have patients who initiate with us to see us here on intervals, initially weekly. We like our patients to come in every week, meet with their nurse, their doctor, really build their relationship and their rapport with our team to help them answer their questions, feel safe, give them education as we're doing with everybody tonight, making sure that we're answering questions and always available. Here's a list of the medications that Addie mentioned also earlier: buprenorphine, Vivitrol, and our long-acting injectable Sublocade, which those medicines are pretty popular in our system and have great pathways to get that medicine delivered to the patient pretty quickly, within 3 to 5 days of the initial contact with an individual. Once a patient has been with us for a little while and they've developed some relationship and maybe some recovery time or some time doing well on their medication and they're ready for the next interval of visits, a lot of our patients get to the point where they're coming, every other week or monthly or even longer, because we've been around for almost 7 years now. So we see a lot of patients even surpassing that monthly interval. So they're coming less and less often with us, which is great. So just a few entry points as how you can contact us, or if you have a friend, a family member, a loved one, anybody who is suffering and you want to share this information, please do. The best way to contact our program is this number here, which is our intake line. We have a team of program coordinators who are ready to answer the phone for you during our business hours, which is until about 5:30 most days. Sometimes we're here a little later, but feel free to share this number. Call us. If you have the individual with you, we like to talk directly to the patient so we can get some good information, explain our programming to that person, and give them all the details around what options are available. And if you miss us at this phone number, you can walk directly into our Harborview emergency department. We have a team of docs who have been and ready to prescribe medicine for those either contemplative, in withdrawal, early onset, lots of different scenarios that are going to play out in the emergency department. But the doctors, the nurses, the staff there, they're really, they really have a straight beeline to our team as well. So we really do work closely with the emergency room to really get to know patients who show up in the ER, so we can then get them plugged into our programming, either here at Harborview or closer to where they live. So please don't hesitate to use the emergency room. If it's a late weekend or after hours, after 5:30, 6 o'clock, please do so. And a couple more links, but they seem like they're very similar to Addie's links. The Washington State Recovery Helpline tool, Addie and I keep harping on it because I think it's a great tool to be able to put in your zip code, look to see what resources are available. The stopoverdose.com has a lot of information around, the advertising that you might need to make sure that you have it in the community center or other places that your youth might be. So I think this is the end of our presentation, but I'll share these slides with our host tonight, so you guys can access them and have this information at your disposal. But I think we're ready for questions.
Thank you, Adi and Elsa. That was a very helpful presentation with helpful resources. There was a question in the chat whether we're going to share this. We're going to upload the video to our YouTube channel, Ethiopian Community in Seattle, as well as upload the link on our Facebook page. So please stay tuned. For those who have called in, to ask a question, you can click on *6 to unmute and ask a question, or if you can raise your hand to ask a question, that would be great. Thank you.
I actually have a question.
Oh, okay.
This is Addie. I'm wondering if anybody has received training in how to use naloxone already. Has anybody received that training somewhere else in the community?
Hi there. Is naloxone the same as Narcan?
It is, yeah. Yep, sure is.
Right. Yeah, my name is Lorraine. I work for the YWCA. So yes, I have received some of that training, but it's always good, I feel, to retrain whenever one gets an opportunity, because we don't really get to use the Narcan. It's not like we're encountering these incidences that often. So I feel that usually it's good to just jump in when there's a training. I kind of just jump into every training to refresh.
Yeah, thanks, Lorraine. Thanks for sharing that.
Thank you.
Thank you, Lorraine. We have Sanait hand up. Sanait.
Yeah, thank you. Hi, Elsa. How are you?
Hi, Sunlight.
It's good to see you. So I had a question for the both of you. Have you guys been doing any engagement and work with the schools, since that's where the kids are at most of the day, and that's where a lot of the interaction with other kids happens and trade-offs and whatnot?
We have not. We don't do a lot of outreach to community schools. I know our public health partners have, And they do a lot of that prevention work at the schools, and the community health workers at the schools, the nursing at the schools. We have been more interested in trying to be a vessel, you know, to catch patients or young folks who are needing resourcing for primary care and for medication support. We just don't have the bandwidth to get into the schools.
Okay, cool. Thank you.
Yeah.
Anything more to say, Addie?
Oh, I'll say I host for healthcare workers, I host a monthly adolescent learning collaborative, and about adolescent opioid use disorder, so youth who are using opioids. And I have people who work in schools in that learning collaborative. Part of what is hard about opioid use disorder, I see youth here at Harborview for treatment of opioid use disorder. And for most of my young patients, their school has been disrupted. And so we weren't necessarily going to find them in school. Although certainly primary prevention, there is a strong role for primary prevention in schools. And a lot of that is happening at the state level.
Thank you.
Yeah, thanks for the question. Such a good question.
Other questions or comments?
So I have a question.
Go ahead, Jordanos.
Okay. So my name is Jordanos. I work with Mother Africa Amharic and Tigrinya speakers case manager. So my question is, do you guys have upcoming open for training? Thank you.
I'm sorry, one more time. Do we have?
Do you guys have for that?
The Narcan?
Yeah, I think she was asking if you guys have an upcoming opening for a training or any dates or resources for when they can access a training for how to use that.
Oh, the Narcan. I think Public Health has some videos on how to use the Narcan.
Yes. My connection is cut. Yeah, sorry. Thank you.
No worries.
Thank you. I appreciate it.
Yeah, I think we could find a video on how to use the Narcan. Their Public Health already has one out, so we'll try to share that same one, and I can send that to Sige.
Okay, great. Thank you.
Yeah, I will say, I think that well, I'll just show you on the Narcan, when you get it, it has a flap here that goes through the steps to use it. It's an incredibly, so the medication comes with the instructions. It's a pretty simple medicine to use. It's administered intranasally, so in the nose, and it comes already assembled. This is the new CPR as far as I'm concerned, and this is much easier to learn than CPR. So if you've done a CPR course, you're gonna crush learning how to use this medicine.
Thank you for that, Adi. Sophia, were you gonna ask a question?
Yes, I have one. Thanks, Adi and Elsa. My question is on the naloxone. So you said it's always good to have that in your purse in case anyone needs it. But how do you know that person is suffering from fentanyl overdose?
Yeah, that's a really good question. So do you want me to take this one, Elsa?
Oh yeah, you can.
Yeah. So An opioid overdose is essentially a crisis of breathing, because what opioids do when you take too many of them, which that's what an overdose is, it's taking more than your body can accommodate. It suppresses your respiratory drive, which is the part of your brain that says, breathe, breathe, breathe. It just shuts that part of your brain off. So often somebody might be wheezing. So it sounds like they're breathing, but they're kind of a wheeze. They may be not breathing at all. When you try to wake them up, they don't respond to you. They don't rouse, they don't alert. What's different than a cardiac event where you would want to initiate full CPR is they may still have a pulse because they're in a respiratory crisis, not a cardiac crisis. So if you see somebody who you can't rouse, you can't get them to respond to you, to wake up, and they're not breathing, or you're hearing them have a really hard time intaking breath, even if you don't know that they took opioids, you can administer naloxone because it's not going to do any harm, even if they didn't take any opioids.
Yeah.
It's an incredibly safe medicine. In all other circumstances, it's inert. And you do still have a crisis of somebody who won't respond to you, who's not breathing. So you want to call 911, administer the naloxone, see if it works, and then still have your emergency responders on the way. Does that make sense? Did that answer the question?
Yes, thank you.
Yeah.
Addie, I have a follow-up question.
Oh, great.
So once you've used the Narcan, and how would you be able to tell if the individual came to or was responsive to the medicine?
Yeah, so it works fast. That's the route. It intranasally gets the medicine into the body really fast. You know, it doesn't have to go through your stomach and get absorbed and all that. It's just going where it needs to go really quickly. So people will rouse pretty quickly. You do want to put people in the rescue position, and this is part of the instruction. You want to get people onto their side, and that's so if they vomit, they don't choke on their vomit or aspirate their vomit. But people will rouse pretty quickly with the administration of naloxone. And if it works and then it like wears off a little bit, or if it doesn't work right away and you're certain that somebody took opioids, you can go ahead and administer another dose. With fentanyl specifically, sometimes it takes more than one dose.
I would say, and potentially the patient or the person may not be feeling well when they come to. So be prepared for that.
Yeah, that is also true. Another concern that people sometimes have is if I am using substances that I know are not legal, and I need to call 911 because my friend just overdosed, am I going to get in trouble for that? And there's a law in Washington state called the Good Samaritan Law that specifically protects people from drug possession charges when they call to reverse an overdose. And it also protects the person who has overdosed. So if people are worried that they're going to get in trouble, like new criminal charges, I want you to know that when you call for help under those circumstances, you don't get in trouble for drug possession. There's a big asterisk to that, which is if you have other pending charges or other warrants, those can still apply, right? That those don't go away, but you don't get a new drug possession charge for calling 911 to help somebody in an overdose. And that's specifically called the Good Samaritan Law. Because people, it feels scary to call, you know, potentially law enforcement to help you when maybe you've been doing something that is against the law. But in this case, that's what we want people to do. We want people to connect people with medical care. Does that make sense?
So is this overdose getting worse, and do we have data to show if it's getting worse in the East African community or among immigrants, or any other data that might indicate?
Yeah, I looked specifically to see if I could find anything about the East African community specifically. I think you would have to tell me, honestly. I didn't find anything in the data. We do know that the opioid overdose crisis in King County is getting worse. And it's specifically getting worse related to fentanyl, this very potent and powerful opioid. I don't know. What do you think? Do you feel like in your community it is getting worse, or you are hearing more about this with you know, with youth or young people, or even not just youth? It's a really hard subject to talk about sometimes too.
I will say anecdotally here at Harborview, we've had an uptick of East African populations accessing the system. And I don't have the numbers exactly, but definitely more than I've seen over the last 7 years.
Do you, Elsa, in Amharic, is it just fentanyl, or does it have a name? Like,
well, heroin, a lot of the folks most recently, almost everything is fentanyl. Just assume it's fentanyl. Methamphetamines is also huge. It's a lot. It's a lot of times together, pressed into whatever the person is using.
I was just going to ask in Amharic if anyone, you know, here on the call has heard of any uptake, or they want to share.
Yeah,
ask please.
እንዴት ነው ጥያቄ መጥቶ ነው በኮሚኒቲያችን ውስጥ ይሄንን እጾችን የሚወስዱ እንደ ፌንታኖል ወይንም ሄሮይን የሚባለውን እጽ የሰማችሁት አለ በኮሚኒቲያችን በወጣቱ መካከል? ምናልባት በዘመዶች እንደዚህ የሰማችሁት አለ? እየባሰ ነው የሚለው ጥያቄ ተነስቶ ነውና ድንገት ሰምታችሁ ከሆነ እሱን እዚህ እንድንወያይ ነበር። የሰማችሁት አለ የጨመረ ነገር ከዘመድ ወይ ከጓደኛ or ከኮሚኒቲ ሜምበር? አንሚዩት አድርጋችሁ መናገር ትችላላችሁ። አቶ ረታ ሊናገሩ ነው?
አዎ ምንም የሰማነው ነገር የለም እስካሁን። እንግዲህ እንከታተል እንደሆነ እንጂ ወደፊት እስካሁን ምንም የለም።
ምንም አልሰሙም። እርሶ እሺ
ነገር የሚያደርግ እኛ አካባቢ
እሺ አይቶ we haven't, it appears no one has heard a lot in our community. Okay, any other questions or comments for Adi and Elsa?
I do have one more thing to add about if you see somebody who's down when you're trying to rouse them, you know, if you know their name, tap their shoulders, call their name. The other thing you can do to try to rouse people, and the reason this works is because it's quite painful. You can use your knuckles and just rub really hard on their sternum. People will rouse to a painful stimulus. And if that doesn't work, you know, those two things together, go ahead and use naloxone, administer naloxone if they aren't breathing.
Gay, I sent you our slides, so feel free to share. Please contact us if you guys have additional questions. Our intake line is open Monday through Friday.
Okay. Is there a language, like if someone wants to call in Amharic, is that access available?
Yes, we have language interpreters here on site. So it would take us a few minutes to connect to Amharic or Tigrinya speaking person
Okay.
with our department, but yes, it's available. So maybe saying that during the call.
Okay.
I have one more question. Thinking about the overdose, so I know it's bad to, to take medicine which is not intended for you in general, but is there a point where you would say this is a red flag and, if you take one more pill, it will be an overdose? Because, what I think is maybe people are thinking, if I take this one, then, I'll be okay. And then you take more and more, and then before you know it, you're dead. So, and even if it's a broad indication, is there a point where you would say, if you feel like this, or if you're taking more than an X amount, then you're looking at an overdose? Does that make sense?
Yeah, I think I understand the question. I'm gonna give kind of a convoluted answer. So there may be follow-up questions. So the thing with fentanyl specifically is that a person can take one tablet one time for the first time ever and overdose because it's that potent, right? Overdose is the part where you lose your respiratory drive and you stop breathing. And actually, people who have never been exposed to opioids, who don't have any history with opioids, they're more vulnerable to that because they don't have a tolerance. They don't have it built up in their system. So that's overdose. The other part is opioid use disorder. And that's somebody who has, ongoing exposure to opioids, and it's really interfering with their life in a significant way. And their loved ones around them are noticing changes. They maybe aren't following through with their school or family or work commitments. And kind of opioids, their focus in life really swings over to really focused on opioids. That's an opioid use disorder. Or addiction is maybe what people would call it. And we can't ever say like, oh, after this number of exposures, that person will have opioid use disorder. It doesn't work like that. But I would say if you see somebody who's really struggling to not use opioids, but they're not able to do it, that's somebody you would want to get connected to our program, to the Harborview program. Yeah. And an overdose can be a sign of an opioid use disorder. So it could certainly be an indication that somebody is having trouble controlling their use of opioids.
Thank you.
Yeah.
And then there was also a question in the chat saying, addictions can also be co-occurring with mental health challenges. How does your program address this and things?
I could take this if that's okay, Adi.
Yeah, please.
Well, we're so lucky. We have a broad system here at Harborview, and we have mental health professionals on site. The very first order of business for us is to really address the overdose and or the patient's opioid use disorder. So getting them started on medicine is essential to having them stabilize and then introducing them to options for mental health if they are so interested. So we have a mental health program at Harborview. It's 401 Broadway. and we work with the team there to really create pathways directly into their service line. And in our primary care clinics, we also have behavioral health practitioners. So if they're already with our primary care clinics, then we have clear pathways that way as well. So offering therapy and support and as much as possible is an option.
Yeah, thanks for that question, Lorraine. And I will also say it's an option, but it's not required. Mm-hmm. So if somebody is telling us, I really don't want to use these services right now, we respect that. And we still treat their opioid use disorder because we want to treat a disorder that has a really high mortality rate.
Mm-hmm.
Great. Thank you for that. Any other questions? All right. Thank you, Adi and Elsa. Like I said, we'll be uploading the video with the slides to our YouTube channel, Ethiopian Committee in Seattle, and we'll be sharing the link on our Facebook pages, and we'll be sharing that on different platforms as well. So please watch out for that. Do we have anything to add, Sophia or Salim, before we close?
Nothing. Yeah, I just want to thank Elsa and Adi for your time. Thank you so much. And thank you everyone for attending today. Thanks.
I would also like to extend thanks to the community for doing such great work in advocacy. I've heard so much of all the work that you guys are doing with our religious leaders and just even educating our families. Thank you guys so much for inviting us and giving us the opportunity to continue to spread this message. And please don't hesitate to contact us or use the resources if there's anything we can do to support.
Yeah, thank you so much for the invitation. We really appreciate it.
Thank you, and hopefully we'll see you guys in other topics as well in the future.
Absolutely.
Yeah. Happy to come back.
Thanks everyone.